Assalamu alaikum, I am Dr. Mah-e-Noor and today the topic of our practical is effects of drugs on frog's heart. The practical command is to demonstrate the effect of unknown drugs on frog's heart. The components that you have to write are apparatus, procedure, calculations including tables and graphs, and precautions. Apparatus includes dissection tools, Ringer solution, and chymograph. Animal will be the frog, and the drugs that are going to be used in this practical include acetylcholine, atropine, adrenaline, and propranolol. Now the procedure. A frog is picked and placed on a frog's board. Heart is incised by a midline incision. Pericardium is removed. A hook is passed through the tip of ventricles. The thread is attached on the other end to a horizontal lever to record the contractions on moving drum. An unknown drug will be given. Let's call it unknown drug A. First of all, record the normal contractions for 30 seconds. Add 0.5 cc of unknown drug now. Record the effect of drug A for 30 seconds. Wash the frog's heart with Ringer solution. Then wait for 2 minutes and record the normal contractions again for 30 seconds. If the effect on heart is stimulatory, then add 0.5 cc of propranolol. Now, without washing the heart, again add unknown drug A on heart. Record the response for 30 seconds. If there is decrease in response, that is, decrease in heart rate and force of contraction, it means that propranolol has blocked beta-1 receptors. It also means that the unknown drug A is probably an adrenergic drug, for example, adrenaline, which is antagonized by propranolol. Okay, so this is the practical and we are taking normal reading for 30 seconds. Stop कर दीजिए. ओके, अब हम डालेंगे इसमें एड्रेनालिन. थोड़ी सी एड्रेनालिन, ज़्यादा नहीं. स्टार्ट कीजिएगा. You can see that the force of contraction and heart rate is increased. So this is the effect of stimulatory drug. Okay, रोक दें. Now we'll wash this with Ringer thoroughly. जी. Now we'll take normal reading again for 30 seconds. Now we will add propranolol. And without washing we will add adrenaline. Okay, start कर दीजिए. Okay, so you can see that now adrenaline is not acting because propranolol has blocked the receptors. Okay guys, so this is the graph that we got at the end of our practical. So we took the normal reading first of all, and then we added our drug. And we know here that this is adrenaline, but in exam you won't be able to know before performing the practical. So how will you know that this is a stimulatory or depressant drug? You will compare the reading after adding the drug with the normal one. So the height of contraction indicates force of contraction, and the distance between each contraction indicates the heart rate. So you know that heart rate and force of contraction is increasing here. That means that this must be a stimulatory drug. So we assume that unknown drug is adrenaline. But if someone asks you that why do you think this is adrenaline and not digoxin, as you know that digoxin is also an inotropic drug. So digoxin, you should not confuse that digoxin only increases force of contraction, and digoxin decreases heart rate, whereas adrenaline increases both of them. Now after washing with ringer and waiting for some time, we took normal reading again for 30 seconds, and then this is the key point. When we assume that unknown drug is adrenaline, we took the blocker or antagonist propranolol and added unknown drug with it without washing. Now you will compare this reading with this normal reading. So you see that there is no effect of adrenaline here like here. That means the propranolol has blocked the receptors. Okay, so how will you calculate the heart rate and force of contraction? So the heart rate is calculated by counting each contraction manually or by putting a formula of time tracing. So the formula of time tracing is contractions in 5 seconds multiplied by 12 equals to heart rate. So you will count contractions in 5 seconds, multiply them with 12, you will get the heart rate, because 5 multiplied by 12 equals to 60. That means 5 seconds multiplied by 12 equals to 60 seconds. So you will get the heart rate in 1 minute. And the force of contraction will be measured with a scale in millimeters. If another unknown drug is given labeled B, wash the heart again thoroughly and wait for 2 minutes. Record the normal contractions for 30 seconds. Now add 0.5 cc of unknown drug B. Record the effect of drug B for 30 seconds. Wash the frog's heart with ringer solution. Wait for 2 minutes and then record the normal contractions again for 30 seconds, just like with unknown drug A. If the effect on heart is depressant, then add 0.5 cc of atropine. Now without washing the heart, again add unknown drug B on heart. Record the response for 30 seconds. If there is increase in response, that is, increase in heart rate and force of contraction, it means that atropine has blocked M2 receptors on heart. And drug B is probably a cholinergic drug, for example acetylcholine, which is antagonized by atropine.
Okay, now so we are taking normal reading again.
Stop.
Now we will add acetylcholine. Start it. You can see that there is a decrease in heart rate as well as force of contraction.
Stop.
Now we will wash it with ringer. Now we will take the normal reading again.
Start. Stop.
Now we will add atropine. Atropine. And after that, without washing, we will add acetylcholine. Now we will take the reading. So you can see that it is similar to the normal reading we took before. That means that acetylcholine is not working because atropine has blocked the receptors.
Stop.
Stop it. Okay, so this was the kymograph from heart attached with the hook to a thread to a liver and needle. These are the drugs. Now in this graph you see we took normal reading for 30 seconds again, and if this is the practical in continuation to the previous one, you will wash the specimen thoroughly before performing this practical. Now let's say you don't know this drug as well, it is unknown drug B. You added it, and now just look at this. The comparison reveals that this is a depressant drug. the heart rate and force of contraction is decreased. The height of contraction is decreased in comparison to the normal reading. So that means that this is an inhibitory drug, most probably a cholinergic drug such as acetylcholine. So now you will wash and wait for some time, and then after taking normal reading, when we added atropine, the antagonist of acetylcholine, along with unknown drug, this reading proves our assumption that this was acetylcholine, because atropine is blocking the effect of acetylcholine. Got it?
If only one drug is given in exam, perform the practical as guided and check its response in comparison to normal reading. The key is that if the response of unknown drug is stimulatory, then add adrenergic blocker given, for example, propranolol. If the response of unknown drug is depressant, then add anticholinergic drug, for example, atropine. The blockers or antagonists are provided with labels on them. Wash the specimen, that is frog's heart, thoroughly, each time with ringer solution. After washing, wait for 2 minutes. Always take normal reading for 30 seconds. Follow the SOPs while performing dissection. Wear gloves and be careful of any injury. An animal should be handled ethically. Now here some VIVA questions are given so that you can prepare for your exam. You can be asked about the receptors present on heart, and you very well know that beta-1 adrenergic receptors and muscarinic M2 receptors are the main receptors which are present on heart, and they control the overall activity. In addition to these, glucagon receptors are also present, and glucagon actually stimulates inotropic and chronotropic activity. If you are asked about the dose-dependent effects of atropine on heart, you know that at 0.5 milligram or at low doses, especially when given through subcutaneous or intramuscular route, atropine causes bradycardia due to the release of acetylcholine in synapse by inhibition of presynaptic M1 autoreceptors, which usually control and inhibits excess release of acetylcholine. So this prevents intake of acetylcholine in exoplasm, which leads to bradycardia. But at high doses, for example 5 milligram, tachycardia is more common due to the M2 blockade, and palpitation can occur. If someone asks you about the pathway of fluid during the perfusion of heart, you should know the circulation of fluid in heart. So the fluid circulates from inferior vena cava to sinus venosus, then to atria, then to ventricles, and then it comes out through the innominate arteries. In this way, the heart is constantly perfused. Other commonly asked questions are classification of beta blockers, especially cardioselective, that is beta 1 selective blockers, and uses of beta blockers, as well as contraindications of beta blockers. Well, you can be asked about anything, but prepare these questions from your main book, that is CATSUM. Thank you. If you have any questions, you can contact me. Allah Hafiz.